My name is Flaura Koplin Winston. I'm a Distinguished Chair of Pediatrics at the Children's Hospital of Philadelphia, Professor of Pediatrics at the University of Pennsylvania, and I direct the Center for Injury Research and Prevention at the Children's Hospital of Philadelphia. And I guess for this effort, I have two key roles. First, I'm a co-founder and chief scientific advisor for Diagnostic Driving, a spin-out from Children's Hospital, and I lead the innovation ecosystem effort at the Children's Hospital of Philadelphia. So I came to this background because I always cared about solving really big, messy problems. I have a PhD in engineering, a background in public health, and I'm a practicing pediatrician. And I brought all of those things together to try to start thinking about how can we solve problems that are affecting children, youth, and their families, their communities, in ways that we could have sustainable outcomes. So I always rely on other people. I never do anything alone. That's one of those myths of innovation. I never do anything alone because with my broad background, I can never be expert in anything. But what I can do is cross boundaries and bring teams together to create robust solutions that are sustainable. So I feel very comfortable talking to a child or the CEO of a company or a senator or whoever it might be. Depends on what the problem is and what I'm trying to get. I cross the boundaries and try to bring all that information into the best solutions that can actually turn into robust, long-sustaining efforts that can actually save lives. I, as I said, care about solving problems. I'm happy that I got promoted. I'm happy that I'm in the National Academy of Medicine. I'm happy about all those things, but I wouldn't be satisfied in my career if it didn't move the needle and make kids safer. I mean, that's really what my life is about, is reducing suffering. That's why I'm a doctor. That's why I'm an engineer, is to solve problems. So I am the co-founder and chief scientific advisor of Diagnostic Driving Incorporated, and we're trying to make the roads safer, one driver at a time. And I started this because I recognized that the leading cause of death for adolescents in the United States, and one of the leading causes across all ages, is motor vehicle crashes. And when you look specifically at the adolescents, you go from your lowest lifetime risk of crashing when you're a learner to your highest lifetime risk the second you get your license. And it's really dramatically high. There are thousands of adolescents who die every year as new drivers, and other people die because of them. And so we created this large simulator. We had not created, we had a large simulator, and we created scenarios, and we're able to validate that it was really good at differentiating experienced versus inexperienced, safe from unsafe drivers. We actually have it paired where I'm continuing to move forward in these research ideas, and the company is scaling it. This company is finding the customers, finding the venues, and scaling it and making it a bigger and bigger infrastructure, and then bringing the data back to us to be able to start thinking about and moving it forward to give insights that then the company can advance even further, but also we can advance the field.